morning. Today I have great pleasure in talking to Doctors Rahul and Bhavna Doshi. Hello to you both.
Hello.
Hello. Hi, Lily.
Hi.
It's great to talk to you. Thanks for joining me. Now, obviously, having both of you on our podcast is really great because we can get both of your stories and what you've been up to. Starting with you first, Rahul. Obviously, I know that you're clinical director of Dentex.
Yep.
What led you to that role? Tell me a little bit about your background.
Okay, so we joined Dentex in 2017, and we joined as what we call regional partners, where we were looking after a group of practices in the Hertfordshire, Essex, London area. That's both of us. And we wanted to, I personally wanted to reduce what I was doing clinically. And we did a great job in terms of being regional partners for Dentex. And we enjoyed doing what we were doing. They enjoyed working with us, and they asked if I could become the clinical director for Dentex. And that's been an amazing journey because Dentex, as you know, has been growing incredibly. It's gained a great reputation, especially for providing clinical freedom and actually making sure that dentists are actually really enjoying being part of Dentex when the practices join.
Absolutely. Well, I can endorse that, of course, because as you know, we work very closely with you guys and we've introduced many of our clients to the Dentex stable. So that's good. Of course, you were also past president of the British Academy of Cosmetic Dentistry. How long were you past president for?
So the presidency lasts for 1 year, but it's a journey towards becoming a president because you've got to be part of part of a committee, part of a board for several years. Then you join the what's called the elective committee, and that's for 4 years. So it is a bit of a sort of a road. So almost coming up to a decade. So I was part of the BACD probably since 2012, and my presidency was in 2019. So several years there. Very much enjoyable, and you know, being an educator in cosmetic dentistry, which we were earlier on, and being sort of the pioneers in cosmetic dentistry, which we were in early 2000, we really enjoyed. Well, I enjoyed being part of it.
Well, that's true, and I'm glad you touched upon being pioneers because obviously it's industry knowledge that you both are obviously experts in UK leading cosmetic dental treatments, and you've also worked with a lot of TV media as well. I know that you've been authors to lots of articles in the press, international and national dental publications. But let's talk a little bit about you taking part in the Extreme Makeover TV program.
So that was quite fun actually. We did all the seasons that they had, and that was something that. It was just a bit of fun. It was we were pretty young in those days as well, but we loved what we were doing, and to see these transformations in some of these people, the before and after, it was just mind-boggling of the things that we can do. And I think it really honed in how important the job that we were actually doing for people out there, for our patients. And it really helped us to, I think during those days as well, we really sort of consolidated our tagline for our business. So we had the Perfect Smile Studios, and we sort of consolidated our tagline, which was changing lives and exceeding expectations. And we were really changing lives, and we really felt that. And I know Rahul has had this as well, but when we saw patients year on, just to see how they're getting on, you know, how the dentistry is, they all would say things to us. And I heard this time and time again. They would say things like, you know, all the sort of liposuction and all the rest of the things that they had done, it's sort of come back to normal again, but the teeth are still there and they're loving their teeth. So, you know, we were really happy that something that we created was, you know, sort of very, taking them into the future and really transforming them. Amazing. We had such an amazing time doing those programs.
I mean, the one thing I think we've got to reflect back on is that they filmed every single aspect of the treatment and dentistry. And I don't think we thought much about it at that time whilst we were doing it, because we just did the work, we did the job. But thinking back, to have actually somebody just film and be behind your shoulder on every single element of exactly what you do and capture that, I think I'd be doing it differently. Not differently because I wouldn't change what I did, but just to have that knowledge that somebody's filming you. We didn't think about it much at that time.
No, and it's just so nice to see that when we watch those clips again, it's just so lovely to sort of see ourselves. You know, I look at Rahul, look, Rahul, you look like that, and you know, I look different.
You look so young.
That's exactly what we said. We were so young,
darling. You look so young.
But it was really amazing, and it just reminded us of how forward thinking we were even in those days with our process of communication with our patients. And we've now been in the industry for like 30 years, and there's just so much that we've sort of contributed to, worked with, collaborated with people, and it's just amazing. So one of the things that when we look back at those videos on Extreme Makeover is we actually, see the advancement of work that we were actually doing in those days. It's really amazing. And when they say Extreme Makeover, let me tell you, it is extreme. I remember having one patient that came in. So when these patients used to come in, because of the filming crew and what have you, we used to shut shop essentially. And I remember one day I had a patient in the afternoon where I was doing these lower veneers on. I'd already done her upper teeth and I was doing the lower teeth now. And she came in, but she had just had a chin job done that morning. So she'd been under, GA and everything that morning. She was all bruised and it was really terrible. And she came in, and because of their contracts or what have you, their timings and things, and they were really trying to fit it into a small space of time. She was expected to have this work done. And I'm sorry, that day I kind of put my foot down and I said, I'm not doing this. I'm not doing this on anyone. I wouldn't do this on, somebody I disliked, let alone people I really like. And I literally said no. And they had no choice but to shut shop and and call her back after a few weeks. So she was so grateful. This particular lady was so grateful that because it's out of their control. It's that extreme. But I said, extreme or no extreme, I'm not participating in that sort of thing. But it was an experience. Let's say it this way.
I bet it was.
Yeah,
I've had a little bit of experience myself in doing television work. A few years ago, my husband and I were approached by an American company, House Hunters International. It's a little bit like the US version of A House in the Sun, Home and Away kind of thing. And they filmed us overseas in Montenegro, where we are lucky enough to have a holiday home. But we had to pretend that we were buying. And so they came to England and they filmed me here in my office and trailed us around. And as you say, Rahul, it's like they're with you for like 14 hours a day. They get there so early in the morning that it's a novelty on day one, but on day 3, you're like, you're actually hanging. Then they went out to Montenegro when it was about 40 degrees. And the irony was that when it finally came to air, after about a week's filming, it was pretty intense. There was about 20 minutes, if that, and a lot of it was repetition. So I know that with TVs, they keep their schedules, don't they? They're very demanding. They're not interested in you saying, I'm tired, can we have a break? Isn't that enough? I don't want to do that. And they're very driven with their own punishing schedules. So I can imagine what it was like for you guys with someone in the chair.
So you're right. So we would do maybe per patient at least about 10 hours of filming, and that would be translated into 20 minutes or 15 minutes at the most. Yeah. But we saw 15 patients, and we probably saw the most number of patients on Extreme Makeover. So yeah, that was great.
Fantastic. And do people ever keep in contact with you that you were on that particular show? I mean, as well as obviously grateful patients, but have you had contact with some that have said, thank you so much for making such a difference to me?
When we were practicing, we did have patients come. Obviously, they'd come for their recalls and things, and we'd see them years on, and up until the point where we both stopped practicing. But we did used to see them, and it was really nice to see how their lives have moved on and the kind of confidence that cosmetic dentistry actually gave people, because it's actually life transforming. We as dentists kind of tend to take this, or people in the dental industry kind of take things, because we're doing it day in and day out, we kind of take it for granted sometimes of the kind of the impact that this work actually has on the world. And our speciality in our practice was cosmetic dentistry, and the lives that we have transformed, impacted, it's just crazy when you see these people. I remember one story of one patient. He was really working. It stays in my mind all the time because I actually use him as an example when I'm actually teaching and training dental practices and teams in my business coaching. So I use his example all the time. And I remember when we did, so he came to us, he'd been really working on the corporate ladder, working his way up. And, he wanted to, he'd been very successful in his career. He wanted to have a life outside of his career now. He started dating and he had these teeth that were stained and they had spacing in between them. And he found that whenever he went out on these dates with these women, they'd just look at his mouth all the time, and he really was really conscious. He kept putting his hand over his mouth, and it was really dragging him down. And he said to me, he goes, Bhavna, I do so much, I'm so high in my profession, and I'm such I've done so well in my career, and I can't believe that these women are reducing me to this sort of level. And
we're so fickle, aren't we, Bhavna?
I know, exactly. And after we did the cosmetic dentistry for him and transformed him, and it's one of my best jobs I've ever done. I'm so grateful for that. I remember seeing him a couple of years after that. He was getting married, and he drove up in his Ferrari, and he was like, this big noise outside the practice.
Big smile.
And he was so happy because he had got his whole life together, in all the areas that he wanted. And, that's one we feel that, so transformational, cosmetic dentistry, what we do. And one of the things that we want to do, so we used to own multiple practices. And then we sort of we sort of hit a crossroads a few years just before we went with Dentex. And we were like, we'd accomplished our vision, our children were growing up, we'd accomplished everything there. So we were sort of at a crossroads of what do we do with ourselves now? Do we retire? What do we do? So, so we hit this crossroads, and it was like, what do we do now? We've got so much knowledge on business growth, on dentistry, on teamwork, motivating teams, leadership, marketing. We've got so much because we created very successful practices. It was just a sort of stage of what do we do? So we both decided that our mission now that we've achieved everything we want to for ourselves, was to go out there and before we retire, to empower as many dentists, dental teams, inspire them, help them transform to the level that they want to. So we want to help as many people as we possibly can now. And that's why we've sort of ramped up the things that we're doing now, because we want to just go out there. We've got so much knowledge, and we just thought it would be criminal. It's actually, I feel that. I really feel that,
passion.
It's visceral.
A real passion,
it's actually visceral that I feel it would be criminal to retire and take all this information with us without sharing it to the next generation and the generation after that. And we really want to impart this knowledge because we've found a formula that works. And we've been able to achieve these things so much sooner rather than later. And we know, because I know when I do business coaching and I'm working with all my clients, and I've been doing business coaching now for over 15 years, but when I'm working with my clients, I see the frustration and the difficulties and the challenges that dentists actually have. Not just dentists who own practices, but also associate dentists as well. And they're sort of plodding along because the truth is, we've not learned business or how to actually see more patients, get the right type of people so we can do the work that we're so passionate about. And we're not taught that at dental school. And then we sort of watch other people do a bit here, a bit there. but we don't really know the whole package, and we don't know the formula that actually works. And me and Rahul working together in all these practices we've practically worked together on all ventures. It's just that sometimes Rahul's in the forefront and sometimes I'm in the back, and sometimes I'm in the forefront and he's in the background. So we kind of work. We've got a good tag team going on.
You've got a good partnership going there, haven't you? And it's very good. Obviously, I work with my husband in our business, and it's obviously has its times, it has its challenges, because you can't help but take work home with you. But your passion is shining through here.
In the next part of our discussion, I'm going to be talking to Rahul and Bhavna about how they got into business coaching, sharing many years of experience, and the formation of the Dental Wealth Builder.
So Dental Wealth Builder is the coaching business. Originally, I was sending small packs out because I thought we're having team meetings and we're looking at things every month. So maybe people might be interested in that out there. And if I send them a pack of things they need to be focusing on every month, then that would be good for them. So I started doing that, but that became a little bit draining on me. And at that time, my children were young. So we've got 2 boys and they were quite young. So it was a bit difficult to do that. So then I slowly transformed. And the other thing was, what I don't like is when I lecture, when I send these packs out, I wasn't seeing the results. I wasn't seeing whether it was impactful or not, whether I was, changing lives or not, whether I was transforming people or not. So I wanted to see that, because that's part of what motivates me. That's what excites me. So I started to then transform the business. It kind of evolved into business coaching. And it was amazing because I've got 100% strike rate right now. So every person that I coach, I will achieve their goals. It's simple as that.
I think in terms of achieving goals, it's about actually achieving harmony in the practice, but more importantly, achieving financial success, which is almost doubling, trebling their growth after we've worked with them for a period of 12 to 14 months. And that's massive. So it's actually holistically helping dental practices in every way.
So we focus on leadership, systems, growth systems, marketing, introducing a sales process, which is more a communication process within the team so that patients can be better engaged, team can be better engaged, establishing their vision. We work with all individual team members. We work with the entire practice. So it's quite transformational. I don't think there's anything quite like it out there. And it's not a standard program. Everyone's different. It's customized and bespoke to this particular practice.
And actually the individual practice owner, because each practice owner has a different character, a different sort of way, intellect, a different sort of way they behave, and it needs to be congruent to them. Otherwise it won't work. And it needs to be congruent to the team as well. So that's really important. So we help guide the team and guide the practice to achieve their vision, as opposed to just giving them a bog standard formula. And it's actually coming from a lot of experience, not just of helping other practices, but also what we did ourselves in the multiple practices that we were working with.
We had one of the practices that we had was the Perfect Smiles in Hartford, and that was like a boutique practice, but it was also my guinea pig. So I used all the strategies and the techniques, and I trialed and errored them in that practice. So I kind of used different facets of it. So if I was working with, say, a particular coach and a coaching client, and I wanted to change something, I would use it in my practice first to see how it would work. So that was really good. And then so we carried on like this for many years, as well as practicing dentistry, and eventually it got to a stage where it was just difficult to manage everything, and we're all about lifestyle as well. So we wanted to maintain our lifestyle, enjoy our partnership. I mean, you probably know this as well, that it's very important to maintain your relationship, and work on each other, work on your family, that sort of thing. So then COVID hit, and COVID was actually quite transformational for me, I think personally, because I started stressing. I know all the dental practices were closing, but I stressed in a big way, thinking, oh my God, how am I going to help people now? And what's going to happen to all my clients and things? So I then, thank goodness to Zoom, I started doing all these how to protect your practice post-COVID webinars. And as I was doing that and teaching, and so I was teaching through webinars, I was having individual team meetings, I was having, all this teaching and training and workshops. But what I did, which was quite life-changing for us, I think, right, was we started developing online programs. So I have now put my entire coaching experience, mine and Rahul's, online. We've got separate programs on transformational leadership, cost-effective marketing, how to introduce communication, the entire coaching program. So what this acts as now is a support element. Or if people want individual things, we've also created different style of programs for associate dentists as well. So everything we could possibly teach is online.
You mentioned earlier, of course, that you're working with my company, with Abby Greenhoff, my managing director, with clients, which is good. It's so important, isn't it, to give people that kind of support for preparation and planning. And you touched upon as well saying that, of course, you don't employ a cookie cutter approach because, and we have the same in our world. When we go and see a client, you can have two practices in the same high street. They can have the same roughly services and turnover, but they are very, very different entities. And ultimately, it comes down to what the principal wants. And people want different things out of life, don't they? So you want some people that just want to make a lot of money. They don't care really how they get to it. But it's so important to understand what the support staff, and you said about the associates, you're doing coaching for associates. And it's so important. And I'm pleased to hear you don't leave them out, because I think a lot of things are they emphasize on the owner, the principal, but it's the support team and it's the associates. It's the whole thing that brings a company to its full greatness. And I'm sure you must meet people that want a very, very different outcome, because one can assume they want to earn a lot of money and make a lot of profit.
One of the things that we do right at the beginning is we have what we call a strategy day. And we literally brainstorm, and we actually invite their partner to that as well, because, sometimes it's not just the dentist, their partner, because it's all about a life vision. So we work on...
Well, that's interesting.
Yeah, so we work on a life vision and then the practice vision, and we actually plan of what we're going to do, how we're going to do it. And, and this actually sort of helps us to really customize a program for them and what they're trying to do. And not only that, so it's about establishing your life vision, your practice vision, and then how we're going to do it in the strategy. But it's also about the exit strategy as well. And you have to, what many people don't understand this is that you have to look at your exit strategy right at the beginning as well. Now, it may change, as you sort of evolve and learn more and, become a different version of yourself and you level up. But you need to have some level of exit strategy, because what many dentists do is they wait until they think about retiring. Then they look at their practice and then they start panicking. I want the most out of this because I need to live off that money or what have you. And they've given no foresight or forethinking into how they're going to live their lifestyle when they stop working. And they leave it till too late. And I always say to I'm going to help you do this now. We need to have a plan. That might change and you might extend it along, but at least you're going to be, better off. Your team are going to be better off because they are going to be, feeling valued. They're going to grow personally. They're going to be able to feel like they're contributing. They're going to be cohesively happy in their jobs, feeling safe. So this is the kind of thing that we work on. It's not just about let's do marketing or let's just do sales.
Focusing on metrics and focusing on KPIs and trying to cut corners. It's all about a holistic growth and focusing on the growth to actually to increase the turnover of the practice, but in a way that vibes with the actual team and also the practice and their family as well.
I agree. It's very important, as you say. We actually ourselves have business coaching, but it gives you support as well. It gives one support as well, knowing that someone is guiding you along. And people, you learn what works for you and what doesn't, but it gives you that support. And certainly in lockdown, that's where we first started doing business coaching. But it is very important. And as you touched upon, some people don't ever think it's too late. It's what I say to clients when we're talking at seminars and we're talking to people exploring their options. It's never too late to start. because it's not just about, as you say, KPIs. It's not just about getting the profits up, the turnover up. There are so many other facets to business coaching that give you the support, not only financially and in the business, but also emotionally, that it gives you.
Sometimes you just want a sounding board. You know what the right thing to do is, but you just want confidence. You want to say to, and I get so many people, I mean, they get my personal number so they can contact me day or night. And I literally say to them, look, I'm here for you. And same with Rahul as well. But they just call to say, look, shall I do this or shall I? And I'm like, you know the answer to that, but they just need that level of support. And that's what we provide. And I think that's really, really helps as well, as you were saying.
Wonderful. Good. So plans for 2022 going forward? You're obviously very busy people. How do you relax, by the way? What do you do in your downtime?
Well, we both have totally differing things that we do. So I love cycling, and I like going on my bicycle, actually exploring the countryside, listening to lovely music, spending the day out, having a few coffees on the way, and trying to keep fit as well. So that's my sort of passion. Bhavna has her own passion.
So I won't even start talking about a passion because I'll never stop.
Bungee jumping? Let me guess. Let me have a guess. Extreme
no,
sports?
Not so extreme. I'm not that. But I actually have a very in-depth passion in fragrances. I actually have an Instagram as well. I'm called Aroma Analyst on Instagram. And I just love fragrances, and I talk about everything to do with fragrances. I've got a massive collection. I've got a fragrance room as well, believe it or not.
So she's actually a fragrance reviewer as such. So so it's a totally different sort of.
So I just review for different fragrances. My area is niche fragrances. So you could call me an expert now. Actually, I would label myself as an expert in niche fragrances. And I put together things like check out my Instagram, Aroma Analyst. I put together things like best cherry fragrances, best vanillas, or best tobacco, or best fragrances for holidays, or beach holiday, coconut fragrances, and it's unisex as well. So it's for men and for women. It's for younger men and for younger women as well. So it's massive.
You weren't expecting that, were you?
No, I wasn't. And I was just thinking, you must be sitting there smelling divine, Rahul.
I do.
When we meet next, you'll know.
Yeah, well, I will. I'll let you know. I'll critique you. I'll start following you on Insta as well, Bhavna. But listen, it's been great to talk to you both. Your energy, your passion, it's fantastic to see. There's nothing jaded about you two. You're talk about onwards and upwards. It's wonderful. I wish you all the very best for the coming year. Bhavna, how do people get hold of you for the Dental Wealth Builder?
So they can go to my website, which is dentalwealthbuilder.com, all one word, dentalwealthbuilder.com, and there's contact details there. And I'm on Instagram as well, so Dr. Bhavna Doshi on Instagram. It's kind of a both of our sort of thing with Dental Wealth Builder Instagram. But I'm very responsive, really quickly, within 24 hours. I'm always on it actually. So if anyone wants to talk to me or DM me or what have you, then please feel free.
So you can't tell your sons off for permanently being on their phones with you.
I can't. I'm worse than they are.
Great. Listen, guys, thank you. Lovely to talk to you.
Good to be here. Thank you so much.
Have a great day.
Thank you.
Bye.